It's been over a year since the first case of COVID-19 was detected in Minnesota, and since then, life has changed and the virus has evolved. Even though we know more about this virus now than we did last March, and many have already received their vaccination, there's still a lot of information to track. So each week, we'll be asking experts about recent COVID-19 developments. Is herd immunity an achievable goal?
How big is the herd that we're talking about? If this is, your school, your workplace, your community, it will be easier to get to a herd immunity level. And that could be anywhere from that 70 to 90% that really helps protect the most people. And that is the case where we will see pockets. We will see counties, we will see communities, we will see workplaces that have a higher vaccination rate. And then we will have to look at it also as a state, what's our risk as a nation, and then as the world. And that is our best chance for not letting it come back. Think of it as a wave that bounces off a wall. If we don't want it to hit us quickly and hard, we really need that herd immunity to be up as high as possible.
Can Minnesota reach a 70% vaccination rate before July 1st?
So we can get there. It will take us about 500,000 people. So if you think in weeks, if before we get to the end of June, if we want to get to 70% herd immunity, we can pick up the pace. So encourage your family's friends, ask them to talk to their providers.
Will we continue to wear masks even after July 1st?
I envision a time where after July, it won't be a mask mandate, but there will be some guidelines or some best practices. You could still say in risky situations, and a healthcare hospital may be one of those risky situations. This is where the most vulnerable are at. Long-term care facilities, the most vulnerable are at. Additionally, I think we will see some people making individual behavior choices. When I have a cold, when I think I have influenza, when I think I have a respiratory illness, or when I'm comfortable, I'm going to wear my mask in public. We really did a great job this year of getting rid of influenza, and that was primarily by mask wearing, watching our behaviors, and staying home when we were ill. We almost made influenza disappear. If I remember, so far we've only had 5 deaths related to influenza in Minnesota, whereas typically it's above 200. So we are saving lives with our masking and our washing our hands and staying home and really decreasing those exposures. We're saving them for COVID and we're saving them for influenza.
The vaccination rate for seniors has hovered around 85% for a few weeks. How are health officials trying to educate and reach those communities?
Number one, if they have transportation problems, imagine they're over 65, but they can't get to a vaccine site. Throughout the state, we are all doing outreach. And that can include an individual community paramedic, home health nurse, somebody that will come out to those one-by-one settings. And I think that's going to be one, is we will have to take this one person at a time. The other parts is, while I know the numbers are slowing down for our over 65, it hasn't stopped. We still see a difference from people that have had their first dose and people that have completed their series. And that's a nice thing too to think about. So as a state, while it's a slower climb, above 80%, 85%, close to 90%, it still is rising. And we should all be grateful for that.